All right, so let's go through heart failure and the differences between right and left-sided. So left-sided is the biggest cause is when blood from left ventricle overflows into left atrium, then builds up in the veins, causing the capillaries to start leaking into the alveoli or air sacs of the lungs. Right-sided two major causes is cardiomyopathy and left-sided heart failure. The symptoms. So symptoms for left-sided would be pulmonary edema. The symptom is peripheral edema for right-sided. Then we have, on this side, we have orthopnea, tachycardia, so increased heart rate, exertional dyspnea, fatigue, cyanosis, and then on right-sided, we also have fatigue, ascites, hepatomegaly, jugular vein distension or JVD, weight gain, and anorexia, because they're not really wanting to eat, but they're retaining fluid, so they're gaining weight. Then they both have the same diagnostic studies. So you'll do an echocardiogram, which is an ultrasound of the heart to detect flow and size of the heart. You'll do an EKG or an electrocardiogram for electrical activity. Chest x-ray to evaluate for fluid in the lungs. Heart catheterization to go in and get a better picture of the heart. And a BNP elevation indicates heart failure. Complications. For both. Would be pleural effusion, which is capillary leakage into the lungs, dysrhythmias, which is abnormal heart rate, ventricular thrombus, which is a clot, most common in AFib, hepatomegaly, just an enlarged liver. This is caused by right-sided. And then renal failure due to decreased perfusion. The treatment goals for heart failure is to maximize cardiac output, decrease symptoms, improve quality of life, preserve organ function, and then this one's a big one right here, because if other organs start failing, it makes it difficult to survive. And then treatments would be like drug therapies. Drugs would be diuretics such as Lasix. Lasix is used because it's fast, effective. Watch for decreased potassium. Hydrochlorothiazide's another Lasix, which is HCTZ, or not another Lasix, another diuretic. Not as fast. And then you'll have your digoxin to increase the contractility of the heart. And then you would have your ACE inhibitors to treat hypertension. And your ARBs, your angiotensin receptor blockers, to also treat elevated blood pressure.